Good morning. So today's class will be on tissue processing. So basically, tissues from the body are taken for diagnosis of disease process must be processed in the histology lab to produce a microscopic slides that are made under the microscope by the pathologist. The techniques for processing of tissues include biopsies, tissues from the surgery, and tissues from. So these are the following protocols followed in the histotechniques like recept and labeling and fixation, dehydration, clearing, impregnation, embedding, sectioning, staining and. So coming to the first one, recept and numbering, tissue specimens received in the pathology lab are a request form that will list the patient information and history along with the description of the site of origin. So the specimens are accession by giving them a number that will identify each specimen for each patient. This is the next. The next is identification. Gross examination consists of describing the specimen and placing all the parts of it into a plastic cassette which holds the tissue while it is being processed to a paraffin box. Initially, the cassettes are placed into a fixator. When a malignancy is suspected, then the specimen is often covered with an India ink mark to know the cut surface of the margin. When sections are made and processed, the ink will mark the actual margin on the slide. An ordinary ink should not be used as this is usually soluble in the reagents used in the process. So a graphic pencil has proved to be more satisfactory. So you can see the cut surface of the tissue which has been kept in a cassette. Tissue processing. Biological tissues are generally firm to hard rather than soft, making it quite difficult to cut acceptably thin sections directly from the fresh or fixed tissue. So methods must be used to hold the tissue firm, which facilitates cutting them with a sharp knife. And firmness can be achieved by either embedding of the tissues or by freezing the tissue. So once it is fixed, it is processed to form and can be made into thin microscopic sections. So it is mostly tissues embedded in the paraffin wax can be cut or sectioned from 3 to 10 microns. And factors affecting processing, specimen size, presentation, heat, viscosity, vacuum, etc. Each process has its own pros and cons. Next is fixation. This is the process by which the constituents of cells and tissues are fixed in a physical and chemical state so that they will withstand subsequent treatment with the various reagents with minimum loss of architecture. This is achieved by exposing the tissue to chemical compounds called fixator. Mechanism of action of fixator. Most fixator acts by denaturing or precipitating proteins which then form a sponge or meshwork, tending to hold the other constituents. The fixator is an important factor in the production and satisfactory results in histology. These are the following fixators and following factors are also important like fresh tissue, proper penetration of tissue by fixator, correct choice of fixators, and no fixator will penetrate a piece of tissue thicker than 1 centimeter. So these are the properties of an ideal fixator. It should prevent autolysis and bacterial decomposition and also preserve the tissue in their natural state and fix all the components. And it also preserves the tissue volume, avoid excessive hardness of tissue, and it should be non-toxic, non-allergic to the user, and it should not be very expensive. Okay, seeing the factors affecting the fixation, temperature, the fixation, and amount of fixated fluid. This also plays a very important role. Like the fixative liquid should be 10 to 20 times more the volume of the specimen, and the fixator should surround the specimen of all the. Classification of fixator, it can be heat, physical or chemical. Under physical, it can be heat and freezing. And based on the type of tissue processing, it can be manual tissue processing or mechanical tissue processing. Based on the tissue, it is soft tissue processing or hard tissue processing. And based on microscopic examination, it is light microscopy or electron microscopy. So coming to manual tissue processing, in this process, the tissue is changed from one container to other reagent by manual method, like by with the hand. So this is what we follow department. So this is the processing area setup where you can see various reagents which are being kept in the jar, and the tissues will be placed in the cassette, and it will the timer will be set, and according to the timing the tissue cassettes will be placed from one jar to other by manual. Okay, next is mechanical or automatic tissue processing. In this, the tissues move from one jar to another by mechanical device. So timings are controlled by a timer which can be adjusted, and temperature is maintained around 60 degrees Celsius. So under manual tissue processing, paraffin technique is most commonly used. Most of the tissue fixators are in aqueous solution. The water has to be removed in order to embed the tissue in the paraffin wax. This is achieved by immersing in increasing strength of ethyl alcohol, and this process is called as dehydration. Since the alcohol and wax are not miscible, the alcohol must be replaced by a wax solvent which makes them clear, hence termed as clearing agent. Finally, impregnation of the tissue with wax and its casting into solid block. Dehydration. It is a removal of water. Rational is for paraffin and embryonic section steps. Wash out the fixator, chloride series of alcohol. Replace the water by diffusion. Next, usually we use absolute alcohol. Otherwise, spirit or isopropyl alcohol or diethyl dioxide. Next is clearing. The next step is alcohol should be replaced by paraffin wax. As the paraffin wax is not alcohol soluble, we replace alcohol with the substance in which wax is soluble. So the clearing agents can be xylene, chloroform, benzene, toluene. Okay, and we use xylene. Impregnation with wax. Higher the melting point of wax, the harder it will be at any given temperature. The plastic point is generally 10 degrees below the melting point. At this point, crystalline rearrangement takes place during the solidification, and behavior changes takes place. A low melting point wax is not suitable for soft friable tissue. A high melting point is suitable for hard tissue. The alternatives to paraffin wax will be methyl methacrylate, raldate, glycol and econ. Time of embedding is recommended that paraffin wax melts at 58 degrees Celsius, and the length and time will be required for impregnation, which will be depending on the size and type of any tissue, clearing agent, and use of embedding. Embedding or blocking. Current orientation of tissue in a mold is an important step in embedding. Incorrect placement of tissues may result in diagnostically important tissue elements being missed or damaged during the microtomy. So, tissue will be finally transferred from the last wax bath to a mold filled with molten paraffin wax, and inverting the tissue to free all the surface of air bubbles and orienting the surface facing the base of cell types of mold. We use the luture here. So L-shaped brass is placed in opposite solution to form a cube or rectangle. The wax will be poured initially, and then the tissues will be oriented in the proper position. High space works can also be used. This is what are the steps in orientation of the tissue. So in automatic tissue processor, 70, 80, 90 is 100% alcohol, each 1 hour in place. Chloroform 1 and 2, 1 hour each overnight. And paraffin wax 3 hours, 3 changes. So closed processor 70, 80, 90, 100, alcohol 1 hour each, chloroform 190, 1 hour each overnight, and paraffin wax 3 hours. So rapid processor is also available. So these are water soluble wax. Last is sectioning. Microtomy is the means by which the tissue can be sectioned and attached to the surface for further microscopic examination. Microtome is a device used for cutting the tissues. Thin section. So they are rocking rotary base shape, sliding and raising mechanism. We use the rotary neck. How does movements rotary? So this is how it works. So you put the block here. This is a node. It's a specific motor. Here there is a motor. So when we rotate, there will be a rotating section coming on. This will be taken into a motor. This is flotation bath. The thermostatically controlled water baths are floating in tissues. After section, to remove the bases of crack in the section, temperature should be 10 degrees below the melting point of cracks. Alcohol or small detergent in the color reduce the surface. Next is mounting. A clean slide is submerged in water and brought into contact with the edge of the section. Section are pushed from the side with slide. Straight approach and push the section in. And section should be centrally positioned in the slide. Section adhesives can for staining. You can use hydroxyl in staining or any other special staining. Next, after that, power slip and mounting medium.